Hello, everybody. This is Debbie Fox with the National Network to End Domestic Violence. Thank you all for joining us today. I see there's a few more folks coming into the room, but I just wanted to do a quick overview. This webinar is being recorded, and we will be sending out the webinar and materials afterwards, so no need to worry about that, and you can send them out to your colleagues and share widely as well. So just a quick overview, our webinar series is part of the Domestic Violence and Housing Technical Assistance Consortium, and we're having weekly webinar presentations and peer-to-peer support discussions on COVID-19. And today we're going to focus specifically on CARES Act funds as it relates to FEMA. In prior webinars, we've covered a variety of funding streams, federal funding streams, from community development block grants to HUD emergency solutions grants. So today we're specifically going to focus on the funds as they relate to the Federal Emergency Management Agency. So we will have Traci Brasher from the Federal Emergency Management Agency joining us, as well as Noah Patton with the National Low-Income Housing Coalition. And they'll be talking about some federal level strategies and ways that states and localities are working together to have domestic and sexual violence programs utilize the FEMA funds to respond to the emergencies that our field is seeing. Additionally, Karen Jarmoc with the Connecticut Coalition Against Domestic Violence will discuss the work that's happening in her state in Connecticut and how those relationships and partnerships were built to access the FEMA funds. And finally, we'll have Amy Turk talk about the work that she is doing in LA at the Downtown Women's Center, and she will provide a perspective from the homeless service provider and their project, California Project Roomkey Initiative, and she'll discuss how the housing providers in LA County are using FEMA funds for the hotel motel vouchering to respond to the COVID crisis for these populations. So I'm going to go ahead and do a quick little overview. If we could move the slide, please. That talks a little about, just so everybody knows on the webinar, just a quick overview about the DV and Housing TA Consortium. We are a very unique and innovative cross-collaborative interagency work group that is funded by federal partners that include the Family Violence Prevention and Services Program, Health and Human Services. Also, we're funded by the Office of Violence Against Women at the Department of Justice. We also, one of our other federal partners is the Office of Victims of Crime at Department of Justice, and then we work very closely with the HUD SNAP's office, the Special Needs Assistance Program, as well as the U.S. Interagency Council on Homelessness. So they guide our work, and then the TA providers, the technical assistance providers that work under this umbrella that's led by the federal agencies is the National Alliance for Safe Housing, and Larissa Kaufman is going to be also helping moderate and answer questions in the Q&A box, so please have questions there. So Larissa is on the webinar as well. We have Collaborative Solutions as part of our partnership, and they are the HUD technical assistance provider. And then I work with the National Network to End Domestic Violence as a senior housing policy practice specialist here as part of our consortium work. And then our other partners are the National Resource Center on Domestic Violence, and they lead a lot of the research and building the evidence base for our work. And then there's also the National Sexual Violence Resource Center, as well as the Corporation for Supportive Housing, which is also a HUD technical assistance provider. So next slide, please. So just a quick overview in terms of the context of the work and how the DV Housing and Technical Assistance Consortium, how we think about and how we are framing our work, and in particular during the COVID crisis. We are reminded daily in the news and with the statistics of who's impacted by COVID, and that is Black and Brown and Native American communities. So we're seeing the impacts of what was already happening within homelessness populations and the domestic and sexual violence populations that we serve, that there is a disproportionate impact on homelessness and gendered violence that impacts communities of color at much higher rates. So we're seeing this overlay of health inequities, housing inequities, and then also rates of homelessness that are much disproportionately higher. So there's a common thread around addressing COVID as we look at the intersection of race, homelessness, and gendered violence. Next slide, please. So some of the stats that are that we know so far, that as of April 28, Black Americans are dying at 2.6 times the rate as white Americans, and that's 26 deaths per 100,000 people. And there's also in Native communities and Navajo nations, there's very high rates of COVID-related deaths, and there's serious disparities as well around those. And so we see the intersection of the racial discrimination and segregation that is a fundamental cause of health disparities and how that's playing out currently in COVID. So when we're thinking about our responses, next slide please, we want to be thinking about the federal funding, state and local funding, and how those communities are impacted, and we want to think about how we're ensuring that communities of color, culturally specific organizations, and those most disproportionately impacted by COVID are the folks that are receiving housing resources and victim services, and that we prioritize those populations when we're thinking about responses in our communities. Next slide, please. So that's just kind of like the overview of our framework of how we're thinking about housing and our responsiveness from a racial equity lens, and building from that framework. And so at this point, I'm going to turn it over to our presenters. We have a really great list of speakers that are presenting today, a wealth of expertise, and people doing really amazing work at the federal, states, and local levels of making a huge difference in getting out resources and responding to the crisis. So I'm going to go at this point and turn it over to Traci Brasher. We're really glad that we have someone from FEMA to be able to join us today to tell us the work that's happening at the federal level and how that intersects with what we're doing with being responsive to housing and homelessness issues as it relates to using FEMA funds. So at this point, I'm going to turn it over to Traci Brasher, and you can take it away. Thank you so much, Traci.
Great, thank you so much, and appreciate the opportunity to speak today. I'm the Acting Division Director for Public Assistance for FEMA, and under the declarations for COVID-19, FEMA has been authorized under public assistance to provide funding for emergency protective measures. That's what we call under public assistance Category B of our public assistance program. Under that category of work, those are the immediate actions necessary to protect public health and safety in response to the pandemic, and should be taken in accordance with guidance from public health officials. So to be eligible for public assistance, an item of work must be the legal responsibility of an eligible applicant. And those measures to protect life, public health, and safety are generally the responsibility of state, local, tribal, and territorial governments. Those legally responsible governments, on some of the things that I'm going to brief you on that we are doing under public assistance, can enter into formal agreements or contracts with private or nonprofit organizations to carry out some of these eligible emergency protective measures. So I will cover some of those that are probably most applicable here. Obviously, some of the actions eligible for public assistance funding are also eligible for funding from some of our other federal agencies like HHS, HUD, and USDA. And simply FEMA does not duplicate any assistance provided by another federal agency, but in the case of COVID-19, we just cannot pay for the same item twice. So one of the first programs under FEMA's public assistance program is our non-congregate sheltering program. For COVID-19, the regional administrators, FEMA has 10 regions across the country. They have been delegated authority to approve requests for non-congregate sheltering when necessary to protect the public health and safety. So we have outlined criteria that must be considered prior to approval of funding for non-congregate sheltering and support services. Some examples of the reason why you would non-congregate shelter under an emergency protective measures are those who test positive for COVID-19 who do not require hospitalization but may need isolation, including those that could be exiting from hospitals. Those who have been exposed to COVID but who do not require hospitalization, and asymptomatic high-risk individuals needing social distancing as a precautionary measure, such as people over 65 or with certain underlying health conditions. Sheltering in this event should be determined by a public health official's direction or in accordance with the direction or guidance of health officials by the appropriate state or local entities. So under these circumstances, a state, local, tribal, or territorial government can request non-congregate sheltering, and upon approval by the region, they can implement that sheltering plan. And we don't specifically include or not include specific populations. So it can certainly include, when meeting the criteria under the emergency protective measures, it can include those populations such as homeless individuals, such as survivors of domestic violence, sexual violence, and human trafficking in this context. So it can't be specific to the circumstances per se of being homeless or being a survivor, but under the criteria for emergency protective measures, if they fall into those populations that have a health order or public health officials' direction or guidance, and the state or local tribe or territory has an approved non-congregate sheltering, then they certainly can be eligible to be included in the non-congregate sheltering. And so there I would recommend, because that's being implemented at the SLTT level, that if you're not aware of it and you're interested, that you contact your local, state, tribal, or territorial emergency management agency. We do currently have non-congregate sheltering approvals going on in 49 states, 3 tribes, and 1 territory. So, and then we do have some requests that are in process at regions right now. So there are, for the most part, the majority of our states have implemented some form of non-congregate sheltering. That sheltering, as I said, must be at the direction of and documented through an official order or guidance or direction from a public health official. It has to be limited to that which is reasonable and necessary to address the public health needs of the event, and it cannot extend beyond the duration of the HHS public health emergency. And then secondly, under our declarations, the incident period must remain open. So at some point, if the HHS public health emergency does not get extended, it's currently, I believe, through the end of July, there's potential for our incident period to end as well. And then at that point, we would not be able to fund any activities beyond that incident period. And then the state, local, tribal, or territory must provide an analysis of the implementation options that were considered and a justification for the option selected. So we don't tell them what options they can use, whether it be hotels, motels, dormitories, or a number of other options that some of our states have implemented through non-congregate sheltering. Some that you may have heard of very early on. I believe the first request that we approved for non-congregate sheltering was for the state of California. And they requested approval of dormitory rooms, hotel rooms, trailers, or similar for non-congregate sheltering to isolate at-risk populations to prevent the spread of COVID-19. So there are, as I said, a number of states, tribes, and a territory doing non-congregate sheltering. So I would recommend that you reach out to that emergency management agency for more information on their specific plan for that. The other thing that we did is we issued a policy for the purchase and distribution of food on April 11th. Due to the impact of the pandemic, there was a recognition, at least, that it'll be necessary to provide food to meet the immediate needs of those who do not have access to food as a result of COVID-19 and to protect the public from the spread of the virus. So again, legally responsible SLTT governments may enter into formal agreements or contracts with private or nonprofit organizations to purchase and distribute food when necessary as an emergency protective measure. A number of states, tribes, and territories are taking advantage of this as well. And they are providing a number of options, whether it be through food banks, whether it be through the purchase, package, and preparation of food, including fresh food and shelf-stable food products, and delivery of prepared meals in some cases can be included in that purchase and distribution of food. So that is another area under public assistance, that there are pretty large-scale feeding programs being implemented by SLTTs for feeding. And then additionally, under our emergency food and shelter program, those funds are distributed in accordance with the McKinney-Vento Homeless Assistance Act, which established the program. And there is an emergency food and shelter program national board. And the purpose of this program is to supplement and expand the ongoing work of local social service organizations to provide food, shelter, and supportive services to those experiencing or at risk of experiencing hunger and homelessness. Those are awarded by FEMA to the national board, which then allocates the funds by formula to jurisdictions with the highest needs. So those jurisdictions establish local boards that determine the funding for the local service providers. It is a needs-based program for which clients must qualify, and the local boards determine client eligibility. The ESFP was appropriated $200 million under the CARES Act to assist those impacted by COVID-19. And then the national board, I believe, allocated those funds to jurisdictions based on a formula. So if you want more information on that, you can also go to FEMA's website. Most of the information on everything that we're doing can be found at fema.gov/coronavirus. It is an external facing web page that has all of our information on it. But again, if you're interested, the first step would be to contact your state or local emergency management agency, as they are typically government agencies, and certain private nonprofits are eligible as the actual direct applicants for FEMA public assistance funding. And I will pause there, as I believe I have taken my 10 minutes. Thank you so much.
Thank you, Traci, so much. I really appreciate, I know you're super busy and taking time out of your busy schedule to connect with us and with the field, and giving us an overview of what it looks like to connect with FEMA and at the state and local levels. So thank you so much for your time. At this point, I'm going to pass it over to Noah Patton, who is the housing policy analyst at the National Low-Income Housing Coalition, and he and the National Low-Income Housing Coalition have done a great deal of work that he will go into more detail about. But in particular, there's a great document I'll put in the chat box about working with FEMA to fund non-congregate shelter during COVID-19. So I'll highlight that, and then at this point, I'll pass it over to Noah to take it away.
Thank you. Yeah, so I'm Noah Patton. I'm a housing policy analyst over at the National Low Income Housing Coalition, specifically focusing on our disaster recovery work within the housing field. So NLIHC coordinates the Disaster Housing Recovery Coalition, which consists of over 850 local, state, and national partners doing housing work in disaster areas. The experience we've gained by doing work after hurricanes and wildfires have really benefited our work to, ensure that the federal government response to disasters reaches all individuals in need and, ensure it does so equitably and as quickly as possible. We've obviously switched a lot of gears from our focus on more traditional DR to COVID-19 response as of late, but we actually run a series of different working groups and such. So if you'd like, you can go to the NLIHC webpage and go to our COVID-19 dedicated page. There's a segment on working groups and such. So we have working groups on, FEMA, on long-term solutions, on state and local implementation, as well as a regularly occurring national call. So next week we'll actually have Speaker Pelosi on to talk about legislative efforts surrounding housing assistance for COVID-19. So that's great. So I wanted to address, the higher risk when it comes to individuals experiencing homelessness. When it comes to COVID-19, people who are experiencing homelessness, either living on the street or in congregate shelters, are not able to shelter in place safely. They lack access to medical care and the basic hygiene practices recommended by the CDC, and if infected, cannot effectively self-quarantine. As a result, they are at an increased risk of coronavirus infection, are more likely to experience severe complications, and are more likely to die from the disease than the general population. People who are homeless and contract coronavirus are twice as likely to be hospitalized, 2 to 4 times as likely to require critical care, and 2 to 3 times as likely to die than others in the general public. If unchecked, as many as 20,000 people who are homeless could require hospitalization during the course of the pandemic. And I just wanted to thank Traci and the public assistance team over at FEMA for rapidly rolling out this program, kind of recognizing the nuance of a pandemic and quickly implementing changes to make the program more effective. I think it's important to note that FEMA was not initially the lead agency for COVID-19 response. The agency was playing a supporting role to the Department of Health and Human Services. But that changed mid-March, and as FEMA began to bring more resources online to deal with the pandemic. So I just wanted to applaud that. That is great. So typically after a natural disaster like a hurricane or a tornado, FEMA will initiate 2 types of assistance programs, kind of this public assistance that Traci spoke of, as well as individual assistance. Which range from household assistance payments, leasing emergency hotel rooms, case management, and the like. So FEMA's only activated public assistance category B, but they tweaked it a little bit to match the circumstances of the pandemic. Most importantly, to my purpose, and I'm sure many of your purposes, is the non-congregate sheltering reimbursement program, which Traci spoke about. So that's pivotal to decongest shelters to avoid further COVID-19 outbreaks and deaths among the homeless community, as well as communities such as individuals living with disabilities, domestic violence survivors, and other folks that live in congregate environments that are placed at a unique health risk when it comes to this disease. So I'd like to just kind of go through some of the recommendations that we've gotten, that we've kind of pulled together while talking with our partners on the ground that are working with FEMA to implement non-congregate sheltering reimbursement. I think the first one here would be urge state public health officials to release guidance explicitly stating that providing non-congregate sheltering is needed for all people living in congregate settings, including people experiencing homelessness, as a public health imperative. As Traci said, FEMA is really following the lead of either state and local, state and local public health officials in approving non-congregate sheltering requests. Those requests can be approved, on the case-by-case basis, as well as on a statewide level in conjunction with a non-congregate sheltering plan. So really, service providers should really be engaging these state health agencies, including emergency health task forces created to address the COVID-19 pandemic and ensure that the eligibility for FEMA resources is as broad as possible, and as well as specific as possible, calling for the decongestion of shelters and other congregate settings as a public health imperative, rather than limiting it to certain individuals that have been that are positively identified as being exposed to the disease. And I think a good way to think about this is that it's a public health imperative to decongest these shelters. So as COVID-19, should it become exceptionally widespread within the homeless community, that would pose a serious health risk for the general population as well, not only those populations that we're talking about now. So the only real way to reduce that risk is to move individuals to safer non-congregate sheltering. Incidences of COVID-19 infections within congregate shelters should be tracked and reported to local health officials to support advocates' claims on the matter, and it should be as broad as possible. I'm excited to hear from Connecticut because they actually had the broadest statewide eligibility that I've seen, and I was very impressed by that. They're doing great work, so I'm excited to hear the next speaker talk about that. So there's also an issue is making sure that these orders are coming from the public health related agencies and not different agencies that while they touch on public health are not specific to public health. That happened, I believe, in Vermont, where I think it was the Department of Commerce or another fiscal related agency requested, issued an order for the decongestion of shelters, and that was not approved by FEMA, so they had to restart the process. So just making sure that the right folks are making those orders and that they're complying with all the material that FEMA released. The second would be urge clarity on program rules, including rules related to reimbursement eligibility, the use of matching funds, duplication of benefits in any agreement reached between FEMA and state officials. Advocates, need to advocate for clarity in programs for all of those things, because vague guidelines seems to assist. So vague guidelines might seem to assist advocates because it gives you wiggle room, right, to kind of work that wiggle room to try and get more people into non-congregate sheltering, to broaden that eligibility. However, we've been seeing that the lack of clarity can cause delays among county and local decision makers who fear that they'll be unable to secure FEMA reimbursement for the cost of moving people to safety because of the vagueness of the definitions. That was specific. We specifically saw that in North Carolina. So the state issued guidance that kind of seemed to imply that all individuals residing in shelters were eligible for reimbursable non-congregate sheltering. They had to release subsequent guidance kind of walking that back. And, it slowed the whole process down as counties and states were unsure of whether to implement the program, more broadly if they, if they were unsure that they would get that money back from the agency. Also, just advocating for your governor, for your local officials, for your public health officials to include the most broad population humanly possible. We're recommending that advocates work with their elected officials to ensure that the needs of individuals experiencing homelessness and other individuals living in non-congregate shelters are included in the scope of their disaster planning, and that statewide non-congregate sheltering plans are put in place immediately. Even if a state is not expected to reach its peak outbreak for quite some time, moving individuals out of shelters and other congregate settings and into hotel rooms will help keep those folks safe should we experience more spikes in cases and should the pandemic intensify in the coming months. Advocates should really be sending emergency managers and state governments detailed information about the needs and vulnerabilities of the state sheltering system and the potential for catastrophic impacts should non-congregate sheltering not be put in place. We found that a lot of housing and homeless service provider organizations in areas where hurricanes or tornadoes are not necessarily frequent aren't they might not know too much about how the emergency management system is structured in their state. They might not know who the local emergency manager is. So we would recommend really reaching out to those folks, doing that research now before any sort of spikes in cases or anything like that, just to facilitate an easier way to go about that. Additionally, we want to urge elected officials to share information about all available resources with organizations working directly with individuals living in congregate settings. It's been a bit tough sifting through this kind of deluge of information, trying to pull out what programs are active, what programs are working, what are the outcomes. So really just impressing upon folks that you have relationships with that are elected officials or folks in your state or local government to really create that information, get that information pipeline really flowing, would really pay dividends for that. I also wanted to talk about, in terms of eligibility as a private nonprofits are eligible to receive reimbursement from FEMA directly. I get personally every day probably like 1 or 2 questions about nonprofit eligibility for FEMA reimbursement. So I'd really recommend that folks go through, number one, speak to your local and state COVID-19 task forces, your emergency management folks, to see if they could provide additional funding for you. And since they're automatically eligible with FEMA to receive public assistance funding, they can get that money back from the agency. So I think that implementing that strategy kind of saves time for local nonprofits that are obviously slammed and over capacity and understaffed at this point. That'll really save time. Of course, if you want to apply, you totally should, regardless of whether you think you're eligible or not. It's always good to see whether you are, just for future purposes. But yeah, we're really recommending that folks reach out to their state and local governments to see if they can snag some of those funding for reimbursement. Of course, making sure that there's no sort of duplication of benefits issues, regarding them providing you with federal funding and then requesting a reimbursement from FEMA, because we certainly don't want that to happen. I think that's essentially that. I don't want to go too far into re-explaining the program because I think Traci did such a wonderful job. But I will say that we have a variety of different resources on the NLIHC website. We have a FEMA toolkit. We have we have a FEMA fact document. We're also sending out 3 times a week a COVID-19 update where we painstakingly cull through the deluge of news regarding COVID-19 and housing to kind of pull out trends and different aspects of that. So I'd really encourage folks, if they're interested, to sign up for those emails, as well as get involved in all of our working groups. Let me see if there's anything else that I want to talk about. I think that is it. So I will turn it back over.
Thank you so much, Noah. Yeah, and I want to just reiterate, I can't say enough about the great work that's happening at NLIHC and that Noah is doing around FEMA, and I encourage folks to join the weekly FEMA work group because it's a really great strategy problem solving session and group, and just it helps me and all of us sort through all the information and stay up to date on all the timely information. So as Noah mentioned, he was excited to hear about what's happening in Connecticut because they have been able to effectively access FEMA funds and use it for a broad range of resources and for all the domestic violence programs in the state. So at this point, I'm going to pass it over to Karen Jarmoc, and she can share the work that she's doing in her state. So it's all yours, Karen.
Thank you so much. Can you hear me okay?
Yep.
Okay, perfect. So good afternoon, everyone. And I just want to thank Deb and her team for asking us to participate in this and to just share our experience in Connecticut. I'm very happy also if anyone has questions or wants to email me offline with additional feedback or questions, happy to answer those as well. So Connecticut, I know that each state coalition is a little different. And how they work with the domestic violence organizations who are doing that important advocacy work on the ground looks different. And so I'll just explain a little bit how this looks in Connecticut. So we are the State Domestic Violence Coalition. We're a standalone domestic violence coalition. We are not a dual sexual assault domestic violence. And as such, probably about 6 years ago, we worked with the Connecticut Department of Social Services to take on what we call a consolidated contract. So what was happening before that is the Department of Social Services was contracting with the 18 sites. There are 18 designated domestic violence provider sites in the state of Connecticut. And so they were basically contracting with each of them separately around shelter and community-based services, and then contracting separately with the Connecticut Coalition Against Domestic Violence, what I'll call CCADV moving forward, to offer some training and TA and a little bit of oversight. And we all worked together with the 18 sites along with DSS to develop a new approach whereby CCADV would be provided one set larger contract, and then we pass through monies to the 18 sites, which we do not just with DSS funds, but also now domestic violence bonus rapid rehousing dollars. We do this with VOCA dollars through the Office of Policy and Management and some other funders. So it's not an unusual structure for us to pass through, but it was new about 6 years ago when we did this very collectively with the Department of Social Services and the 18 sites. So given that that happened, when the pandemic started, it really offered us some unique options in terms of how we resource some additional supports to domestic violence advocacy and also to domestic violence survivors out in our state. In particular, when the pandemic started in early March, so to speak, we just use that as our benchmark. Domestic violence shelters were at 130% capacity. And what that means is that with 227 licensed beds, we know that we are always going over that number by hosting individuals and families in general area rooms and family rooms. Like many of the domestic violence shelters across our states, we have families and individuals who share rooms. With new social distancing requirements, understandably, we needed to quickly address that circumstance. And so we've been functioning statewide at 98% capacity in terms of individuals in shelter, but our system still remains over capacity because we have many individuals and families who we are hosting in hotel stays nearby the domestic violence organization so that they have continued support and advocacy. What we also knew is we just needed additional resources, to support the needs of families during this really unique time, specifically around food, perhaps around housing, basic needs. And we also needed resources unique to the pandemic around crisis counseling. So 98% of advocates are working remotely during this pandemic, but checking in and talking with victims like never before through text, through email. We have circumstances. We just did a webinar last week with one of our sites, and they have a process whereby they have sort of an emoji signal where they're working with victims who are feeling unsafe in their home, and how advocates are being very innovative in terms of how they converse with victims who might not be able to be actually on a phone, but who can be texting with an advocate if they need help. And so it was really, I have to thank the Department of Social Services in Connecticut, because it was their administrators who reached out to our state coalition early on during the pandemic to say, we are putting together as a state agency an application to FEMA, and could we get some data from you so that we can include domestic violence and resources for survivors and advocacy in that application. And because we are managing a consolidated contract and therefore data, we were able to just really seamlessly and quickly be responsive to that, because as everyone knows, things have been moving very fast during the pandemic. So we were included, and thankfully the application was approved. And what this has meant for each of the 18 sites is basically for 3 months of resourcing, and I'll get to what it's resourcing, but each site is receiving approximately $36,700. That's $660,600 in total. And those dollars are have already come to Connecticut and are being issued to the 18 sites, again, through our similar process that we do with our established DSS contract. And so we've been able also to utilize those funds for what we would call crisis counseling. And that is because our governor, Governor Ned Lamont, on May 1st announced that that FEMA had approved a portion of his ongoing request for disaster assistance, and to have a part of that be crisis counseling as an approved measure that can be funded with the dollars. And so that actually added a lot of support for what we call comprehensive advocacy. We know that it has had to look very different during this pandemic, much more intense in some circumstances, a lot of follow-up. We have found that the outgoing calls by advocates to survivors and victims has more than doubled during this pandemic. We have noticed that our statewide resource and hotline hub, those calls have nearly doubled, and also 60% of the individuals reaching out either through calling, texting, email, or live chat are individuals who've never reached out before. And so these resources from FEMA, which have gone out to all of those 18 sites who are doing the important work on the ground assisting victims, are funding things like comprehensive advocacy, transportation, housing, and food. And it's been really helpful in terms of the advocacy community and their ability to not have to worry about how they were going to resource these things, and to be able to focus on keeping families and individuals safe and offering them some enhanced stability during these very uncertain times. So I'm happy to answer any questions, but that is how we were able to work with our state agency, DSS, in Connecticut to utilize FEMA funds for victim advocacy for victims of domestic violence.
Thank you so much, Karen. It's really great, and just what gives a lot of hope for our work to hear what's happening in Connecticut. So thank you for sharing what's happening. And then also I just want to do a quick reminder as we're winding down the hour. If people do have questions or things that they want to chat about in the box, we have a whole wealth of expertise with the consortium folks that are here in the chat box, as well as our presenters. So please do not hesitate asking questions or sharing information, or if you're having challenges, we'd love to hear that as well. So please join us in the chat box for the Q&A. And so I'm going to turn it over to Amy Turk at the Downtown Women's Center in LA to share what they're doing in Los Angeles. So go ahead, Amy.
Thank you, Debbie. The Downtown Women's Center in Los Angeles for the last 40 years has been providing services for women experiencing homelessness through permanent supportive housing, healthcare, and access to employment pathways. And you know, for a long time now in Los Angeles, we've certainly been calling for a FEMA-like response to the crisis of homelessness, of where we're a county of people who, there's 60,000 people experiencing homelessness in Los Angeles County. So we've been long crying for this response. However, certainly we didn't mean to ask for a pandemic, but we're just so thankful for the partnership with FEMA. And as Terry said, the state of California, through Governor Newsom's leadership, was very quick to respond to the needs of people experiencing homelessness through setting up Project Roomkey. And this is a collaborative between the state and our County of Los Angeles and our lead continuum of care, which is the LA Homeless Services Authority. The hotels and motels that we've secured to protect people at high risk of mortality if they contract COVID is 75% reimbursed by FEMA. It's also an effort to help keep businesses open, to keep motels and hotels functioning during this time. In our community, we first chose to use it as an opportunity to decompress congregate living shelters where it was not possible to keep people distanced from each other. And we focused on individuals who are 65 years and older with underlying health conditions who were not positive for COVID. Thankfully, in our community, we've set up medical sheltering sites for people who do test positive. Homeless Services made the referrals in to Project Roomkey. And so Downtown Women's Center entered this collaborative just 6 weeks ago. I got a call from the head of the LA Homeless Services Authority with a unique opportunity to help one of our local missions decompress their shelter. That mission is just down the street from Downtown Women's Center, and many of the women living there come to our access center during the day. And so I got that call on a Friday morning, and we moved in 45 women into a hotel just a couple miles from us the next day. The staffing model is comprised of Downtown Women's Center as the lead social service provider. And we are joined by city and county staff who are now considered disaster service workers. So these are staff that have been redeployed from their normal activities to help ensure 24-hour staffing and support to the women and all the folks that are in motels and hotels across the county. It also is supported through 24/7 security. And the county has partnered with a social enterprise called Every Table. And every day they are delivering meals for 3,000 people across Los Angeles County. And the staff at the hotel hand out the meals with the nursing staff. And so at least 3 times a day, the folks that are living in hotels are provided with a health screening and receive a meal. And to Terry's point, the scope of work for the social services doesn't duplicate other funded services. So Downtown Women's Center has overlaid our other programs to ensure that the people that are living in the hotels are being screened and accessing permanent housing. We just had one woman last week move into permanent housing directly from the hotel. And so as a whole system, we're really looking at opportunities for acquisition of new low-income housing opportunities. These could be the existing hotels and motels, or they could be different locations. And the acquisition funds are coming through federal COVID relief dollars. However, one of the main challenges as we think to the future is that we don't see a pathway for long-term rental subsidies or services funding just yet in the state of California. On the systems level, this has really reprioritized how we're looking at coordinated entry with a focus on ensuring that these people that have moved into Project Roomkey have access to permanent housing. We've prioritized our community's permanent supportive housing. In fact, 80% of our permanent supportive housing will be prioritized to people in Project Roomkey. We're also looking at how our rapid rehousing dollars could act in a more interim way for people that are in the hotels. Could they then move into a rapid rehousing opportunity while we keep them in the queue for permanent supportive housing? Because we've focused on folks that are 65 and above, we've essentially created the need for more recuperative care referrals and more geriatric health services needs. We're also keeping an eye to the demographic data of the 3,000 people that have moved into the hotels. To date, though, we have not yet overlaid how many are survivors of domestic violence, which is a data ask that is in. But for folks that are accessing services through our domestic violence services, thankfully, our mayor in Los Angeles, Mayor Garcetti, through private dollars, the Mayor's Fund, has set up another motel opportunity. We're calling this Project Safe Haven. People that enter these hotels have come through the hotlines of domestic violence services who can no longer take new people into their shelters due to the need for safe distancing. This is, like I said, privately funded. Some high-level names have come in to support, including Jack Dorsey and Rihanna. And it's been a wonderful partnership, and due to the private funding nature, it's not fully coordinated with our coordinated entry system. So we're seeing some siloing and some distancing of access to the permanent housing resources that are now being prioritized through Project Roomkey. But we're just so thankful that a number of collaboratives and initiatives where the foundation was laid in Los Angeles, whether that was through the Domestic Violence Homeless Services Coalition or our coordinated entry partners, we've been able to mobilize quickly and to move into practices of innovation, including mobile services or utilizing the domestic violence housing first model more quickly. And we also are seeing some opportunities to get cash into the hands of people experiencing homelessness or survivors of domestic violence, especially for whom have been impacted economically due to loss of jobs related to COVID. And those are remarks, and I'll turn it back to Debbie and our facilitators.
Thank you so much, Amy. And thank you all for posting some questions and thoughts into the chat box. I want to just take a moment to thank all of the presenters as well. We only have a couple of minutes left. We took it right up until the end. And actually, if we can change the slide, please. Thank you. So here we have some additional resources for you all to check out. We will be sharing the PowerPoint as well as the resources that we have already mentioned in the chat box. For those of you that have just posted a couple of questions that we might not be able to get to, if we turn the page, please. We have the contact information for our presenters. Also, please feel free to reach out to Debbie and myself. This is Larissa, hello, with the National Alliance for Safe Housing and or through Safe Housing Partnerships for technical assistance. We've been providing a lot of support around CARES Act funds, access for domestic violence programs, coalitions, and survivors, and working with a range of different stakeholders to make that happen or try to assist in making that happen. Okay, next slide, please. As part of that effort, we've actually created a short survey. We want to hear what you all are seeing on the ground. We want to hear more about specific areas where we can provide technical assistance and support, whether it be FEMA, CARES Act generally, other specific funding practices, whatever the case may be. We really want to hear from you all in terms of what you're seeing and at this point. And I think with that, let's go to the last slide. last slide is just acknowledging our funders. So I'm going to actually, since we have only 2 minutes left, I'm going to go ahead and actually wrap up the session because I don't think we're going to have enough time to do sort of an active question and answer. But as I said, thank you so much to all of the presenters. I love learning something new, and I know that I did today, and I hope all of you did as well. The strategies, just the layout of FEMA funds, how they can be accessed, who to contact, all of those really important questions are the questions that we've been hearing and fielding now for months since the passage of the CARES Act with the FEMA funds. And so we're so grateful to all of you, Traci, Noah, Karen, and Amy, for providing your perspectives, insights, and all of your knowledge today. So I want to thank you all once again. Thank you to Debbie, my co-moderator, the consortium team, and we will continue to be hosting our special topic sessions every Thursday. We have a couple of those already set that are coming up, so please look out for those if you haven't seen them yet. And please, again, reach out to us if you have any questions. We'll be sending out the recording, materials, and resources within a couple of days after today's session. So thank you all so much.